Are you paying too much for health insurance? If you're paying for your own health insurance, then affordable care is not so affordable at all. Introducing Smart AHIPs. Save money and reduce taxes. Association Health Insurance Plans. Imagine you employed over 1,000 employees, or even 5,000 employees. The carrier would be inclined to give you a large group discount rate and abide by federal large group regulations. Well, after recent federal and state regulations have changed, self-employed small business owners can now join existing large group union or association plans, also known as AHIPs. The benefits of joining a large group may vary from state to state. You see, due to the manner in which large groups are regulated, carriers such as Blue Cross Blue Shield Association, Cigna, Nationwide, are required to abide by large group anti-discrimination ratings practices. This results in a large group association plan having preset national rates rather than state-regulated rates. Under this federal oversight, carriers are not allowed to rate based on your age, gender, or zip code. This means rates are on a national average cost basis. This is particularly favorable for associates over the age of 40 who live in high cost of living states, whereas state-regulated individual or small group plans rate based on state, zip code, and size of family. This could be very expensive in some states. This ruling also allows for large groups to expand their marketplace across state lines, effectively adding more choices to the associate consumer. In many cases, AHIP plans are PPOs, have low copays, and in some states have zero deductible. Meet the Williams family. At the top of the pyramid is their primary care plan and the Williams family's primary source of health care. If either of them has a symptom of illness, they simply pick up the phone 24/7, 365. By using telemedicine, they have access to immediate care by a U.S. board-certified physician who can diagnose, treat, and write prescriptions. Now, if the illness is of an urgent nature, they can go to the nearest urgent care ER, or they can elect to visit their PPO primary care doctor and pay a small preset copay. This component also covers all of their general health care, including physicals, pharmacy prescriptions, labs and diagnostics, etc. No deductibles to worry about. Now, in the event that Mr. Williams were to have an unforeseen accident or illness that required a surgical procedure or extended stay in the hospital, he would be covered by the second component, his major medical policy. Mr. Williams has anywhere between a $0 to $5,000 deductible, depending on his plan. And once that's been satisfied, he doesn't need to worry about coinsurance calculations. He's covered for 100%. Now, if Mr. Williams happens to get diagnosed with a critical illness, his Smart Insurance program utilizes its third component, its critical illness component. This component pays him a lump sum to cover his deductible if any convalescence, lost wages due to hospitalization, at-home skilled nursing care, etc. It even doubles the amount in the event he succumbs to his illness or injuries. But as time will tell, the Williams family remains injury or critical illness free. So a portion of their premiums earns them compounded interest in an account that keeps growing, tax deferred. Now that's the smart way to buy healthcare. All for 30% to 50% less. Call or email us today for your free quote.